Hi again, everybody, and welcome to this week's Living Better with TriHealth segment. I'm Dan Hord with Dr. Seth Isaacs. Our topic this week, chronic sinusitis. What is it and how is it diagnosed?
So chronic sinusitis is defined as a persistence of sinus infections and symptoms of those infections for over 3 months, or repeated infections that just don't respond to antibiotics over that 3-month time frame. So symptoms of sinus infections include nasal congestion or blockage, facial pressure in the cheeks and forehead, green or yellow mucus coming out of the nose, and even dental pain, as well as fevers. And so that really is how the diagnosis is made by most physicians. The diagnosis can be made by your primary care physician, ear, nose, and throat doctor, or even sinus specialist. And often that will involve going over those spectrum of symptoms, as well as looking inside the nose, looking for any degree of swelling, discolored mucus. If you do go see an ENT or a sinus specialist, they'll typically look in your nose with a small telescope, kind of looking back at where the sinuses drain into the nose, again looking for swelling, green or yellow mucus, or even nasal polyps, which are just a sign of real severe inflammation within the nose. And then further diagnosis often can sometimes include a CAT scan, where we get this high sensitivity X-ray that looks at the sinuses, the degree of inflammation in the sinuses, as well as even some fluid that would be a marker of an active infection.
Dr. Isaacs, what is the medical treatment?
So like most sinus infections, the medical treatment involves antibiotics. For the run-of-the-mill sinus infections, people are typically treated with 5 or 7 days of antibiotics. But for chronic sinusitis, typically you need a nice long course, like 3 to 4 weeks of antibiotics consistently. Another form of treatment are steroids, such as prednisone, to decrease that inflammation and get the sinuses open and draining again. Other treatments include treatment for allergies. About 60% of people who have chronic sinusitis also have allergies. So we do need to identify those allergies and treat them with nasal steroids, antihistamines, or even antihistamine nasal sprays. Another form of medical treatment would be sinus rinses. A lot of people have used neti pots throughout their lifetime, and it's just simply salt water that helps flush out the nose and the sinuses. And then there's also surgical treatment. Surgical treatment for sinusitis usually involves a general anesthetic procedure where we go in through the nose with little telescopes and get the sinuses open and draining. There are no incisions on the outside of the face, no black and blue marks. It's outpatient surgery, and typically people go back to work in about 3 or 4 days. Recovery is about 2 weeks, 2 weeks of no heavy lifting or strenuous activity.
Dr. Isaacs, are there preventative measures to reduce the risk?
There are. Like I had mentioned, 60% of people with chronic sinusitis also have allergies. So often my patients will be sent to an allergist where they're tested, allergens identified. I mean, the most common treatment for allergies is still avoidance of those exposures, but again, treating them with allergy shots, steroid nasal sprays, antihistamines. Smoking can adversely affect the sinuses, so I do always counsel my patients on quitting smoking. And then mold exposure can be a huge cause for chronic sinusitis, especially living in a river valley such as we do. I often have patients who move to an older building through where they live or where they work, and they start getting sick. So I do encourage them, if they can pinpoint that exposure, to have it tested and treated by professionals.
That's Dr. Seth Isaacs, and I'm Dan Hord. For more information, visit Bengals.com/TriHealth.